This is our physical exam being recorded for health assessment nursing. Hi, Dr. Kroger. I'm Leslie White. This is Jeff. We've come in, I washed my hands, met Jeff, noted his vitals when he first came in. Temperature is 98.6, pulse 85, respiration 16, blood pressure 130/80. All of these are normal for Jeff, and he's not in any pain. Jeff, I'm Leslie. I'm going to be doing your physical today. Nice to meet you. Do you have any questions or concerns before we get started? Okay, so we'll start the exam. I'm going to inspect and palpate his scalp. So what I'm looking for are any lesions, masses, lumps, looking at the scalp, making sure that there's no scaling. The skin looks good. I'm feeling for any suspicious nevi or bumps. It feels good. We'll move on to the ears, and with the ears I'm looking again for any lesions, bumps. I'm assessing the pinna, pulling back, assessing for any tenderness. I'm going to press on the tragus, look behind the ears. I'm looking for any scaling. It's a good spot for skin cancer, especially in men, to appear right on the tops of the ears. We'll go ahead to the other side, same thing. Pulling on the pinna, any pain, tragus, behind the ears. So we'll go ahead and start with cranial nerve number 8, which is the acoustic nerve. So I'll have you plug the ear here on this side, and I'm going to whisper 3 words, and I need you to tell me what they are.
Wednesday, Thursday, banana.
Okay. And the same thing on the other side.
Tuesday, Friday, table.
Good. So cranial nerve 8 is intact. We'll go ahead and move down, looking at his eyebrows. They're full. They go the full length of the eye. The lids, I don't see any drooping or ptosis. Lashes, no scaling. Sclera are clear and white. Conjunctiva looks pink. His lenses look clear. And we'll go ahead and start assessing cranial nerves 2, 3, 4, and 6 for the eyes. So we'll start with taking a look at our cover test. I'm going to have you look straight at my nose or straight at this pen and pull this away. Good. Straight at this pen. Pull this away. Good. We'll look at Perla. Pupils are equal, round, and reactive to light. So I see good constriction from about 3 millimeters to 2. And then I'm going to cover and take a look at the other side to make sure that the right side is constricting in conjunction with the left. And it does. So that looks good. Same thing on the other side. Perfect. We'll go ahead and assess facial nerve, which is cranial nerve number 7. So I'll have you puff your cheeks, smile, frown. Good. And I'm looking for symmetry on his face, and that's what I see. So cranial nerve 7 is intact. Now we'll go ahead and check our 6 fields of gaze. So I'll have you follow my pen. And that looks good. I'm not noting any stigmas. I want you to go ahead and tell me when you see movement in your peripheral fields, okay?
Okay.
Okay, good. We'll go ahead and move on to cranial nerve number 5. I'll have you close your eyes, and I want you to tell me when you feel me touch.
Okay. 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 Okay.
Okay, that's the sensory portion, and then there's also a motor function for cranial nerve 5. So open, close, good. Go ahead and open your jaw, move it side to side. Excellent, so that's intact. I'm going to assess his lymph nodes, so posterior cervical, anterior cervical, mental, preauricular, and postauricular. And I'm not noticing any lumps, masses, any tenderness with palpation. Okay. muscles along the back of the neck. I have paraspinous muscles, I have trapezius muscles, I have sternocleidomastoid. And I'm going to assess carotid pulses one at a time, and they're 2+. 2+, good. We'll go ahead and assess his spinal accessory nerve, which is cranial nerve number 11. So shrug your shoulders, good. Turn your head, good. Turn your head, okay. So now, moving on to nerves, cranial nerves 9, 10, and 12. So I'll have you go ahead and open your mouth, good. And then look at his oral mucosa, it looks pink, it looks moist. I'm not noticing any lesions. Go ahead and lift your tongue up and say ah. Good. So uvulus midline, tonsils are 2+. Saying ah is, and sticking his tongue out, that's cranial nerve number 12, the hypoglossal. And go ahead and swallow. Good. No problems with secretions, and that's cranial nerves 9 and 10. Okay, moving on to our thoracic exam. I'm looking for 2 to 1 ratio, which I see. I'm going to go ahead and step behind him and assess for lung expansion. So go ahead and take a deep breath in and out. Good, it's symmetrical. Any costovertebral tenderness? Any tenderness there? Good. Okay, so I'm going to have you turn sideways towards me. We'll pretend that this is the end of the bed. And I'm going to listen to your posterior lung fields. I want you to take deep breaths in through your mouth and exhale out. Again. And if you feel dizzy, I want you to let me know and you can stop. Good. So no wheezes, crackles, bronchi, or rales. We'll go ahead and listen to the lateral lung fields. Good, same thing. We'll have you turn towards the front. And now we'll go ahead and assess the anterior lung fields. And what I'm looking for is
Facing forward.
Yeah, you're doing good. Bronchial sounds here, bronchiovesicular sounds over the main branches, and then vesicular noises in the more lateral lung fields.
Deep breaths or regular?
Just regular. And I've noted that his trachea is midline, breath sounds sound good over all of his lung fields. We'll go ahead and I'm going to just assess your patency, because if there's any congestion, it would be amplified if he's breathing through his nose, swallow, include one side. Good. Good. And did you smell the coffee when you came in this morning? Okay, so that's his olfactory cranial nerve number 1. Now, Jeff, I'll have you go ahead and swing your legs over the end of the bed and lay down. We're going to assess your cardiovascular. Okay. And so here, where we'll start is first on carotid. I've already palpated it, but I want to listen to it for any breweries. So we'll be using the Bellabreath stethoscope. then we'll start with our cardiovascular, and I'm gonna palpate first, over my specific points. Second intercostal space, sternal border on the right, that's your pulmonary valve, palpating for any thrills. Moving to the left, second intercostal space over the left sternal border, that's your aorta. Third intercostal space, we've got Erb's point, sternal border.